Hello, my name is Keith, and this is part of a series of videos providing program development opportunities for nonprofits. These videos might help you determine a better way to manage programs and avoid common mistakes. This video is about how to become a certified application counselor designated organization and manage volunteer certified application counselors. There are many organizations within your state that actually have navigators who are paid out of a grant, but some places, or many places, don't realize that you can run a health insurance certified application counselor program without being a part of that grant and actually operate even as volunteers to provide people access to the health insurance marketplace and to help people sign up for affordable health insurance. If you like these videos, please click subscribe on my YouTube channel. So to become a certified application counselor designated organization, also simply known as a CDO, partnerships with community organizations are vital to reaching uninsured residents across the state, especially in underserved communities. Contact your state agency responsible for the CAC certification process. Each state is different. They have a different location at their state capital that is, or state department that is responsible for this program. Certified CDOs do not receive grant funding. Certified CDOs are responsible for overseeing the work of affiliated certified application counselors, including training, day-to-day management, and monitoring certified CAC activities. Certified or CACs are individuals who are certified and licensed by the state to support consumers with applying for health coverage. So to get started, first of all, you would want to make sure that you recruit your volunteer certified application counselors. Your organization can help your community with access to health insurance by serving as an enrollment location for the health insurance marketplace. There are a couple options for recruiting certified application counselors. First of all, maybe identify one staff or a couple staff or even volunteers that can complete the training and certification process. One thing you'll have to do is make sure that they do complete the training and certification before they actually can start serving clients on behalf of your agency. Make your agency available to assist in the training and certification of certified application counselors for partner agencies. I've done that before where I assisted other organizations in our community to either train navigators or certified application counselors. That's when I also served as a lead for a navigator organization. A certified application counselor is an individual who is certified and licensed by the state to support consumers who with applying for health coverage. Certified CACs are also referred to as assisters. Certified application counselors are required to be affiliated with a certified CDO. So if you're a CDO, they can't operate on behalf of an agency unless they're affiliated with an organization like yours, either as an employee or a volunteer. Certified application counselors provide unbiased support and educate consumers on healthcare options. They can't direct people towards any specific plan, though it is best for the CAC to be knowledgeable of all the plans. Like certified navigators, certified application counselors are not permitted to advise consumers on which health plan is best. So for the training, training for the certification. To be eligible to serve as a health insurance certified application counselor, each applicant must be registered with the state insurance office. You'll go online, identify how to sign up to become a certified application counselor, for that particular CDO. and you apply for registration with the state. Be aware that when you're making the application, it will ask you for the name of the CDO organization you're doing this on behalf of. Review the fees. There are fees for signing up to uh, register with the state, and also you'll need to schedule fingerprinting. And you don't do that on your own. You do that through the same portal that does you do the registration for. And then after you've registered with your state office, you complete the FFE Assister training for certified application counselors. Um, if your state is part of the federal marketplace, you'll go to the portal.cms.gov to do the training. Some states, like Georgia, have their own portal where you would sign up to do your training at. Complete and sign the conflict of interest form, and then also I recommend before you get started, each certified application counselor also complete HIPAA training. So let's say you have your certified application counselors in place, and they have done they've registered with the state and have also completed the training to become a certified application counselor. What do you need next? Well, what I would recommend is to make sure they have the equipment and the consent forms they need. So each certified application counselor will need a laptop, a printer, a scanner, and a portable file case that can be logged. They'll also need individualized consent forms with their names on it so that every individual who is assisted will sign a consent form. For scheduling, as individuals are referred for access to health insurance, you gather their contact information, provide it to the next available and accessible certified application counselor. So you should have at your location a phone number designated just for appointments, or the one a phone number that you could advertise in the community for people to call to set up appointments. Not necessarily a good idea to have that number be the number of the certified application counselor themselves. It's better to have that mid person to take those appointments and then pass that information on to the certified application counselor. All calls will come in, and staff will take the messages and send them to the certified application counselor depending on the location that they're at, where the person is calling from, and where the CAC is providing services at. So for the enrollment process, open enrollment begins on November 1st and lasts through mid-January. The certified application counselors assist consumers with enrollment in the marketplace, also in Florida Kid Care and Medicaid at various targeted locations. I recommend, as I did in my past experiences, setting these enrollment locations up at local libraries, co-locate at hospitals, specifically the hospital business office, because that's where people come in that may necessarily not have insurance, and also employment agencies where people are seeking assistance with other things as well. Then they have the enrollment process during the special enrollment period. That starts at the end of the open enrollment. The certified application counselors assist consumers with special enrollment in the marketplace, Florida Kid Care and Medicaid at targeted locations serving vulnerable consumers, and these should be locations where clients are already seeking help for other services, like basic needs facilities, volunteer income tax assistance sites, places where people sign up to receive food stamps, or even food distribution centers, places where people are already lined up to receive services. For outreach, the health insurance certified application counselors attend health and wellness events, volunteer events, and other community events to distribute marketplace materials, Florida Kid Care and Medicaid materials, with contact information for the health insurance certified application counselors. That's where you would attach your phone number so that people will know where to call to set up an appointment. And you can order products, any CMS products, at productordering.cms.hhs.gov. Distribute labeled materials at community events. Distribute labeled materials to community agencies serving vulnerable populations. Distribute labeled materials at certified application counselor and enrollment sites. Your certified application counselors can provide educational opportunities for healthcare providers and consumers, advertise and provide virtual healthcare classes for local healthcare advocates that include information regarding access to health insurance, advertise and provide virtual health education classes for local consumers that include information regarding access to health insurance, and provide in-person classes on health insurance policies, Florida Kid Care, Medicaid, and the federal marketplace. For marketing, the Health Insurance CDO, your organization will provide marketing opportunities to promote your CAC program. Public service announcements are made for local open enrollment and also for special enrollment periods to be sent to local media. Promote Florida Kid Care, Medicaid, and the federal marketplace with contact information for the health insurance certified application counselors on social media sites. Email distribution of Florida Kid Care, Medicaid, and the federal marketplace materials sent to local health care advocates and providers, and share health insurance certified application counselors with local health care and hospital coalitions. And finally, for reporting, the certified application counselor meeting and reporting, your organization will provide monthly reporting and updates on your certified application counselor's activity. Your organization will submit a monthly report and an update on work plan goals. Your organization will meet monthly with the contract manager from the state, and your organization will meet monthly with the consortium of statewide partners. Thank you, and if you like these videos, please click subscribe.